Next up, we have Dr. Venkatesh Shivane from Aquatic Remedies. So, yeah, Dr. Venkatesh, you could take over. Thank you.
Yeah, can you hear me?
Yes, we can.
Yeah, fine. Thank you, Tushar, and thank you, Ami, and thank you, Dr. Amit, for inviting me to speak today on something novel, which is first time in India, which is getting published in treatment of type 2 diabetes. And it is last week published article, which I'm going to show you the results. This is something exciting, something new, and it requires further validation through clinical research. But I'm going to show you whatever the work we have done. This is a airborne, low frequency, multi-frequency, non-contact ultrasound in type 2 diabetes management, a novel treatment strategy. So what is something which is required, ladies and gentlemen, to just go in quick of the physics, that ultrasound is a mechanical compression of the wave produced from a piezoceramic crystal that has a frequency above the human hearing range, and it has the effects depends on the frequency as well as intensity. So there is a high intensity, there is a low intensity. We know high intensity ultrasound is being commonly used in cancers, in malignancies, in ablation of thyroid, parathyroid, or liver malignancies, or some of the bone malignancies, including varicosities of the veins. The low intensity ultrasound is used in hyperthermia. What is we need to know about is there are two effects of low intensity ultrasound, that is thermal as well as non-thermal. The non-thermal effect first is sonophoresis, which is the movement of the drug molecules across the skin. Sonoporation is the formation of small pores in the cell membrane through which the by using ultrasound there is a transfer of nucleic acid material into the cell, and ultimately the drug gets completely embedded in the cell. The last one of the important effect of low intensity ultrasound is the acoustic streaming, which is defined as the physical forces of the sound waves that are driving the force capable of displacing the ions and small molecules. So there is a cavitation formation and collapse and gas bubble formations. And as we know, as I have told you, there are various indications for which ultrasound is used. The first of such kind of instrument was used by postgraduate PGI Chandigarh with my senior colleague Dr. Anil Bansali and Ashu Rastogi. They used it in non-healing diabetic ulcers, and they have seen that when you give this ultrasound to such ulcers, the recovery time or the wound healing time is reduced compared to the sham control. Now, what we thought of that, the airborne ultrasound effects, it may help in it will increase the cell permeability and it will improve the potential action of the drugs. So first, we did the animal studies with National Institution of Reproduction and Research in NIRH, Mumbai. We have shown that there is no animal toxicity or genotoxicity which has been seen with this ultrasound over a period of 28 days for 10 minutes of ultrasound per day for 28 days, or even 60 minutes of ultrasound per day. And we have not seen any DNA damage, as you can see in the slides. So with what we did, this study, what we have done is effect of airborne low intensity multi-frequency ultrasound on glycemic control, lipid profile, markers of inflammation in patients with uncontrolled type 2 diabetes. It was a proof of concept, that is a pilot study, randomized, double blind, and placebo control. So such type of equipment which was used, which is having a airborne low intensity multi-frequency ultrasound, which emits the energy of 20 kilohertz to 65 kilohertz. That's very low, and it works on the frequency of multiple frequency ultrasound principle. That is the principle. It has a non-invasive treatment of diabetes, especially in improving. That was something what we have thought, that it may improve the absorption, distribution, metabolism, and elimination of the drugs, as well as improving beta cell function in type 2 diabetes. So there were three centers which have been selected, two of Mumbai, which is Dadar and Worli, and Pune. Ethics committee approval was taken. The trial was registered with clinical trial registry in India, and the patients were recruited in the year 2019. A written informed consent was opted from all the patients. Uncontrolled type 2 diabetes patients who are aging 18 years to 70 years, who are on stable oral hypoglycemic drugs for a duration of more than 3 months were selected. And definitely the patients who are having chronic cardiovascular events were selected, but acute complications, acute micro or macrovascular complications of diabetes and other systemic illnesses like kidney failure or hepatitis, or maybe a pregnant lady, were excluded from the study. The patients were randomized into two groups. Group A, which was called as ALIMFUS, and Group B was placebo. The patient has to visit the site every alternate day for 45 sittings. And during each sitting, they were exposed to 10 minutes of low frequency ultrasound, which was emitted by ALIMFUS device or placebo. The overall hypoglycemic agents that the drug of the patients were continued and dietary lifestyle changes were advised to the patients. Now, for this ultrasound, patient was advised to sit 5 minutes away because it was acoustic streaming. So they can definitely, the range was decided as 5 feet away from the equipment for ALIMFUS, and similar type of equipment was used for placebo. And you can see that this patient, he's taking the ultrasound waves with ALIMFUS. The I said the efficacy parameters were judged by fasting as well as postprandial blood sugar on monthly basis and HbA1c. The anthropometric parameters like body mass index, total body water, lean body mass were calculated by bioelectrical impedance machine. HOMA-IR was calculated. Body metabolism rate was on calculation basis. The other parameters like lipid profile, biomarkers, which were insulin, C-reactive protein, adiponectin, homocysteine, tumor necrosis factor, and interleukin-6 were evaluated. And quality of life of this questionnaire was taken. The safety parameters were definitely the vital assessment, including heart rate, electrocardiogram, respiratory changes or blood pressure changes, and other safety investigations like liver function test, kidney function tests were done. A statistical analysis was performed using SPSS version 25.0. We have screened total 186 patients, out of which 116 patients were randomized, 57 in ALIMFUS arm and 59 in the other arm. The rest of the 70 patients were screen failure because they were not meeting, either they were not meeting the criteria or they refused to continuation up in the study. There were 5 dropouts in ALIMFUS group and there were 8 dropouts in placebo group. So total 52 patients completed with ALIMFUS, and placebo 51 patients were completed. You can see that the baseline parameters, including the age of the patients, the duration, the fasting blood sugar, the HbA1c were fairly comparable. However, at baseline, the total cholesterol and LDL cholesterol was slightly high in ALIMFUS group, and adiponectin and insulin levels were low in ALIMFUS group. So at the end of the study, we have noticed that there is a reduction in fasting as well as postprandial blood sugar in overall ALIMFUS group. When we sub-analyze these patients with categorizing them with a HbA1c more than 8, we have got the statistically significant reduction in fasting as well as post-lunch blood sugar. What we have noticed at the end of the study, that the HbA1c in ALIMFUS group was reduced by 0.77% compared to closer to 0.47% in placebo group. Albeit the intergroup difference was not statistically significant. When we talk about the cholesterol parameters, the total cholesterol was significantly reduced compared to baseline in ALIMFUS group. Significantly reduced the LDL cholesterol, so-called as bad cholesterol, significantly reduced in ALIMFUS group. The markers of inflammation were fairly improved, and that was surprising for us, that the mean insulin level at the end of study with ALIMFUS group was statistically significantly elevated. The marker of inflammation, CRP, was significantly reduced with ALIMFUS. The homocysteine levels were reduced with ALIMFUS, and the adiponectin levels were elevated with ALIMFUS. And other parameters like leptin, we have not seen any change, but vitamin D surprisingly was elevated with ALIMFUS group. The rest of the anthropometric parameters have not shown any significant changes at the end of study between the two groups. However, the quality of life, the non-significant trend was noted towards physical endurance improvement score with ALIMFUS. Of course, there were certain adverse events, 27 in ALIMFUS group and 31 in placebo group. There were 2 serious adverse events. One was urinary tract infection and other was lower respiratory tract infection, but both were not related to the study drugs. And rest of the safety parameters like liver function test, CBC, ESR, and renal function tests were normal. So with ALIMFUS group, HbA1c was significantly reduced by 0.77%. However, insulin levels were increased from baseline. There was a significant reduction in fasting as well as postprandial blood glucose, and there was a trend towards lowering of HbA1c in ALIMFUS group compared to placebo. This was achieved without significant hypoglycemia, weight gain, or any other procedure-related side effects. And this HbA1c reduction, we can compare with maybe other drugs which are used in type 2 diabetes like DPP-4 inhibitor or SGLT2 inhibitors or alpha-glucosidase inhibitors. As a monotherapy, our efficacy was shown to be comparable. The possible mechanism of improvement of glycemic control could be insulin release by beta cells after ultrasound therapy and enhancing the uptake and action of ongoing oral hypoglycemic agents. Further, ultrasound therapy may play a role in improving insulin resistance and reduction of glucagon as well as gluconeogenesis, as a clinical study, pilot study, which was done in Ukraine on 30 patients. Compared to placebo, the difference was not significant. However, even in placebo group, the HbA1c was reduced. This was because of multiple visits to the site and proper counseling by the doctors to the patients. Nonetheless, HbA1c in ALIMFUS arm was numerically more significant compared to the placebo. Greater number of patients in ALIMFUS group achieved HbA1c below 7%, which was desired as target. As I have told you earlier, that total cholesterol and LDL cholesterol were significantly decreased in ALIMFUS group. The mechanism of this change is unclear because this was a pilot study. However, there is a similar study done overseas in Europe. They have shown that in centrally obese women, ultrasound lipolysis was associated with improvement in abdominal fat and blood cholesterol levels. However, in our study, we have not seen any improvement in abdominal fat, especially in females. Similarly, there was a homocysteine and CRP decreased and adiponectin were improved after treatment. So markers of inflammation were fairly improved and there was an improvement in insulin resistance. So in conclusion,
Dr. Shivane,
last slide. This is in conclusion, ALIMFUS could be the novel technology in diabetes management for the patients who are unable to achieve glycemic targets on combination therapy of oral hypoglycemic agents. It has shown modest, non-significant reduction in HbA1c, quality of life score, markers of inflammation compared to placebo, significant improvement on lipid profile, fasting and post-lunch blood sugar, especially in the subgroup who is poorly controlled with HbA1c more than 8. However, we need further exploratory long-term studies and it requires to demonstrate its exact role as an add-on therapy in type 2 diabetes management. Thank you very much.
Thank you so much, Dr. Shivane.
It is my pleasure to say a few words about him. This professor in medicine.
Thank you, Dr. Vyakatesh. I think it was a very promising presentation. Though, as you mentioned, we need more data, more studies, more people to be involved in this to understand. Just a query, since you said that it helps the beta cells to produce more insulin, so you feel that it should be used in the early stages of diabetes, or it can be used patients who are in longer duration of diabetes also?
Well, I think, Amit, it's a very nice question. We need to evaluate across various stages of diabetes. What we have taken poorly controlled patients who are on combination therapy of type 2 diabetes initially because it was a pilot study. The CGM study with the same equipment are ongoing and maybe in a couple of months the data will be also available. I think that should help to put the exact picture and exact role of this molecule or this equipment, where to put it, whether as a in early stages of diabetes or maybe people who are already on oral hypoglycemic agents like sulfonylurea or metformin. So we need some more data, and I think maybe over a period of time we'll be able to answer that question.
Dr. Venkatesh,
thank you so much.
Yeah, Rakesh.
Congratulations for your presentation. It was very good.
Thank
Unfortunately,
you.
I had to shuffle it between the other halls because the durations are going in the other hall. Congratulations for your publication. This paper has been published already in a reputed journal.
Yeah.
And we look forward to further follow-up research on this particular topic.
Sure.
Thank you.
Thank you, Dr. Rakesh, for giving me opportunity.
Thank you for coming on 11th hour. I invited you, I guess, just a week back. You agreed to come, and that's I'm grateful for that. Thank you.
Thank you, Tushar, and thank you, Rakesh. Thank you, Ami, as well. Thank you.
Really appreciate this. Thank you, Dr. Shivane.
Thank you.